If you're feeling tired all the time, you're seeing bruising without any explanation, and you're seeing frequent infections, these could be signs of something more serious, something like leukemia. Leukemia is the cancer of your blood that might be living inside you for years or even decades, giving you certain signs that I will reveal to you in today's video. Signs that you should know how to recognize, and you should know how to stop or make sure to reverse in your body before this disease becomes a full-blown cancer that grows out of control. How can you recognize it? What should you be doing? What are its risk factors? And what things are you doing every single day that are just putting gasoline onto the flames and seeing a disease grow without any control? Leukemia is a type of cancer that affects mainly your blood and bone marrow, exactly where your blood cells are produced. It can progress rapidly or develop slowly. It could take a year or maybe 10 to 20 or 30 years to show on your body. But there are signs, there are symptoms that might be showing frequently that you don't know how to explain. Maybe you'd visit the doctor because of frequent infections or flus or fevers with no explanation, and no one gives you a real answer. How does leukemia come about? What are its signs? What are its symptoms? And what can you do to reverse it before it's too late? Before I move on, go ahead and subscribe to this channel. I've always been surprised at the amount of people that watch these videos but have not yet subscribed. Go ahead and press that bell notification button also to make sure to receive any notification of a video that might save your life. Number 1, what is leukemia and what are its symptoms? Leukemia is a cancer. It's a cancer of the blood. When we say cancer, we mean a overgrowth or an exponential growth of certain cells in our body that are specified to an organ. In this case, our blood, which is not an organ, but these are cells that are transported all over the body. Now, leukemia mainly affects the production of white blood cells, the body's immune defense. It can lead to the accumulation of abnormal cells that crowd out the healthy ones. They put them aside, and you see a lot of white cells in your blood when obviously they should be all in equilibrium. Now, there are two main types of leukemia, but there are many others also. You have acute leukemia, which may appear rapidly, or chronic leukemia, which appears over the years, or that you might have during a long period of time and you have not noticed it until now. Now, its symptoms are very important because this is what's going to save you. Any cancer that you can actually identify early in stage is going to be easy treatable. If it's been a long time that you have leukemia, it's still treatable, but just a little harder. So some of its symptoms are the following: extreme fatigue, feeling tired all the time, seeing paleness on your skin, your face, your body, frequent bleeding, maybe on your gums and nose, easy bruising without injury, and petechiae. Petechiae is basically red small dots that appear on your skin that signify that there's some type of bleeding on the skin. And this is very important because at hospitals, it's a very important sign and symptom that you might see in leukemia patients. Some of the immune system include frequent and hard to treat infections, too many flus in 1 year, fever with no clear cause, night sweats, or even bone and joint pain. That obviously some of these symptoms might be confused with others, making it a little harder to diagnose, but that's why if you recognize the signs and symptoms, you can actually do something to stop it or reverse it before it's too late. If you need something natural to keep your body healthy, make sure that you are making blood healthy enough to keep your blood well stabilized. Go ahead and look for Red A+, multivitamin, D enzymes, and probiotics from Fineland at finelandvitamins.com. Number 2, what are the causes and its risk factors? Many of the things we do every single day might be just putting some gasoline onto the fire of this leukemia that is still not full-blown, but will be if we continue to do things that we should not be doing. One of the causes might be using and taking medications or taking in toxins that your body should not have. You have to remember that everything you take by your mouth, everything you eat that is not organic, has pesticides, has benzenes, has toxins, medications, or chemotherapies, are going to affect the way your body functions. Especially the way your bone marrow, which is very delicate, is going to produce all these cells. These toxins are going to end up affecting you. And the other thing that is extremely important that many people do not understand with leukemia is that your bone marrow needs all its ingredients in order to form healthy blood. If you do not have a good nutritional source, if you're not eating healthy meats, fats, vegetables, fruits, and foods that are organic, healthy to eat, and you're only basing your diet off of ramen noodles, maybe just carbs or packaged goods, well, your bone marrow is not going to have enough vitamins, fruits, vegetables, irons, or ingredients and healthy fats to form cells. If I don't have enough of these ingredients, I'm going to have a hard time producing some of these type of cells. I'm going to have anemia. Maybe anemia over the years is going to skew the production of certain cells in my bone marrow. I'm going to have a nutritional deficiency, and all of these factors and all of these causes will end up making things a lot worse. Remember, your body is a perfect machine of making blood, but in order to make it, you need to give it all its ingredients, and at the same time, make sure that these ingredients are healthy, not toxic, and what you're eating is not full of any pesticides or toxic materials or even drugs that might affect the functioning of your entire body. If you need something natural that contains all these natural ingredients you might be looking for, look for D enzymes, on cardio, extremely important for circulation, Probillion, multivitamin, and Red Aid Plus from Fineland at finelandvitamins.com. Number 3, how is it diagnosed and how can you treat it? Number 3, how is it diagnosed and how can you treat it? Leukemia is a cancer of your blood, meaning you have to draw blood and see it on a microscope in order to see how this blood is reacting. The first thing you need is a complete blood count. This may show very high or very low white blood count cells, and also your doctor might ask for a bone marrow biopsy. This confirms the diagnosis because it shows what your bone marrow is producing. This is where you make blood cells and where you need to know what exactly your bone marrow is making. This way you can actually see what type of leukemia you might have, acute, chronic, myeloid, and many other leukemias that, depending on the blood cells you're making, is going to affect your treatment. Go ahead and look for a doctor, look for someone that can help you treat the situation. And if you need a consultation or an advice, you can always check the number down here on this YouTube video to make sure to schedule an appointment so we can help you. God bless and take care.